Hello, everybody. Thank you for watching this video. Today, we're going to specifically talk about psychosis, about schizoaffective disorder, schizophrenia, psychosis, drug-induced psychosis, because frankly, a lot of you have asked me this question. And I am happy to provide expertise and my analysis on not just the Reiner situation, but how this impacts a lot of people. There's a lot of people out there asking questions about mental health disorders, about medications, about psychiatry, about addictions, about rehab, about substances like methamphetamine and cocaine, forensic issues, criminality, sociopathy, personality disorders, just family dynamics, and the personal element of can anybody snap? There's just lots and lots of questions that are coming up, and I really want to thank you guys up front for the questions that you've been asking, the comments you've been making on my previous videos, the really well thought out questions, and how this impacts the world, how this impacts our families, how this impacts all of us. A lot of people are asking these questions. And again, for me, I want to make it really clear, I do not know the Reiner family. I do not know any of them. I don't know the specific background or detail, nor am I diagnosing anybody. I am just providing expert opinion based on my experience on what might be happening here, and more importantly, or just as important, how this impacts all of you, how this impacts our families, our society, our humanity. And with that, I want to say that, my background and the reason I'm talking about this with my expertise is I'm a double board certified physician in psychiatry and addiction medicine. I've done a lot of specialty training in relational therapy. I do a lot of work in personal development, specifically, how do we lead a better life and what can we do to lead that better life? I have a more kind of existential background, and I've done a fair amount of work in forensics, and I consulted at Twin Towers, the correctional facility. I've done some personality profiling work. I've done a lot of work in that space. So I feel like I do have some qualifications and some experience, more importantly, in maybe providing and lending some insight and some wisdom into what might be going on here. I want to start out, before I get into psychosis, to say, I don't necessarily view myself as a psychiatrist. I don't say, hey, everybody, I'm a psychiatrist. I say I'm a humanistic psychiatrist. I mean, most of the time I just say my name. My name's Reef Karim. That's my name. I don't go by, hi, I'm Dr. So-and-so, because I don't need my identity to be connected to the fact that I'm a doctor. I love the fact that I've learned the knowledge that I have. I'm very happy I'm a doctor. I'm very happy that I really have gained this insider's perspective on the human mind and the human spirit and why we do what we do. But I don't lead with it. I lead with the fact that I'm a human and a like human, and people have different skills and different experiences that make them who they are, and I have a skill and experience that makes me who I am. It doesn't make me any better than anybody else, or it just makes me different. And so I always lead with my name. And the reason I tell you that is I feel I'm more of a humanistic psychiatrist than I am anything else in title when we talk about credentials. And humanistic meaning I look for the human element of everyone that I work with, everyone that I talk to. I know we all have an existential background, and I don't like to label people like, you're a schizophrenic, or that's a bipolar person, or that's a borderline person, or that's a this, or that's a that. I try to say that's a human being who is maybe suffering from symptoms or a condition that we call blah, blah, blah. It's a lot longer to say. It's a lot easier to say, that guy's just this. But I do think there's respect that we need to have for individuals who are suffering, because look, none of us are perfect. We're all suffering with something. Okay, with that in mind, let's talk about this. A lot of people have been asking about schizophrenia, schizoaffective disorder, psychosis, mood disorder, things like that. specifically in this case, but also in their own families and you know, to gain their own perspective. And I'll say this, schizophrenia affects, if you look at the research, between 0.3 to 0.7%. Some people will say 1%, but you know, it's a legitimate number, but not a super large number of people that are suffering from this condition. It's a true mental health condition. It is not necessarily curable. Some people have thought maybe there's some kind of viral element to it, but there is genetic predisposition. There is neurobiological change that you see. There are positive symptoms and negative symptoms. The positive symptoms are the obvious ones that we see, the hallucinations, specifically auditory hallucinations, but the delusional behavior, the cognitive difficulties. There's a lot of things we call positive symptoms. There's also things we call negative symptoms, which are, you know, your affect. I've seen people that they withdraw, they have a lack of expression. They might be muted in their emotion. They might have diminished speech or like a social withdrawal. So the obvious ones, like the paranoia and the persecutory and the hallucinations, are super obvious. The negative ones aren't as obvious, but they're there. A lot of people that have schizophrenia have suicidal behavior as well, because nobody wants to necessarily live like that. There's something called schizoaffective disorder. It is a different disorder than schizophrenia. It is not the same. It is where you essentially have this blend of schizophrenia type symptoms, the positive and negative symptoms of schizophrenia, that are commingled with mood disorder symptoms. Mood disorder symptoms fall under the whole mania and depression. So there could be grandiose behavior, rapid speech, pressured speech, rapid thoughts, spending sprees, this heightened kind of elevated mood and increased energy that feels episodic, that goes along with the mania aspect of mood. But there's also potentially depressive effects, the anergia, the fatigue, the anxiety, the depressed mood throughout the day, the sleep issues, all the stuff that goes along with being depressed. And in fact, there's schizoaffective disorder, bipolar type, schizoaffective disorder, which is more manic, depressed type, which is more on the depressive side. Anyway, the reason that I tell you that is they've been using both of these terms in this case with, well, initially it was schizophrenia, now it's been more schizoaffective. I say that because when we look at somebody who allegedly committed something so tragic as this, so challenging as this, where there was mutilatory behavior and murder and all the rest. I don't want people to think that, oh, we have schizophrenia. Schizophrenics, people with schizophrenia, I almost did it. People with schizophrenia are murderers, and when they go off and they get psychotic, they're this, they're that. No. Almost all people that are suffering from schizophrenia, not all, but most all, are more the victims themselves of other crimes, of people harming them or stealing from them or doing things to them, being abusive toward them, than they are people that are attacking others. Now, I say that with the caveat, or that if you have schizoaffective disorder on top of, not on top of, but instead of schizophrenia, and you now have potentially psychotic and persecutory delusions, which of themselves are usually internal. You might scream or yell at somebody, but it's very rare that you would act on it violently, especially to this degree. But now you add a mood component with schizoaffective. And in the circumstance where somebody is not only psychotic and maybe having persecutory delusions and paranoia, but you now add the fact that they might be manic. And with mania, grandiose behavior, elevated mood, high energy, racing thoughts. You add that to a baseline of psychosis. Now you've got two red flags, okay? Now, on top of that, if you added methamphetamine or cocaine, or especially meth, a high-level illicit drug, now you've got 3 red flags. Now you add a potential personality disorder, like sociopathy, like antisocial behavior, where there's lack of guilt and remorse and high-level severe sociopathy is not really treatable. So you've got people that may have had oppositional defiance or conduct disorder growing up, and they set fires to things when they were kids, and they abused animals, and now suddenly they're adults. They have no remorse, no guilt. They do bad things, and that can get worse and worse and worse. You attach that to psychosis, mania, and illicit drugs, and let me tell you, meth especially, but quite a few illicit drugs, but especially meth. There's really good research showing the impact, the negative impact on executive functioning, and on abstract ability to reason and ability to make judgments, wiped out, diminished. So somebody acutely on meth has a very hard time saying, this is a bad idea. I should not do this. I should be thinking differently. This is a bad outcome. I don't want to do this. They have a really hard time with abstract reasoning, judgment, cognition, executive functioning. So now you've added that. So you've got this recipe, this cocktail is just terrible if what's reported is true, that potentially psychosis with paranoia and persecutory delusions and hallucinations, with potential mania and elevated mood and everything that goes along with that grandiose behavior and all of the manic type symptoms that goes along with the methamphetamine wiping out the executive functioning deficits and all the other effects of meth, which include psychosis and paranoia and worsening persecutory delusions. It's like taking the initial psychosis and just expanding it like crazy. Then you add the personality disorder on top of that and everything that goes along with sociopathy. And now you sprinkle that whole thing into the Hollywood culture where, and I can do an entire, by the way, I've been asked by enough people that I'm going to do a video on Hollywood culture. I'm going to do a video on rehabs. I'm going to do a video. A lot of people ask me about, what do you mean by spirituality? And what do you mean by, for me, it's that existential belief system, but I'll get into that. I'll do an entire video on that. There's so many videos on mental health, and is mental health misunderstood, or what is the real way to look at mental health? There's so many things I can talk about with this, and I promise I will do videos on each of these as I can. But you add all that stuff together and you put it inside Hollywood culture. And what I mean by that is Hollywood itself is a stressor. And I'll do a video on this, I promise, and I'll get into the depth and the detail. I've worked in Hollywood. I've treated for confidentiality purposes, I can't really talk about who, but I've treated a lot of professional athletes and rock stars and A-listers and high-level people, politicians, royalty. And I've also treated the incarcerated, the disenfranchised, homeless people. And their brains are not that different. But what is different is how they're treated. And bad care by not getting the treatment, the right and effective treatment, which could happen for the homeless, could happen for the disenfranchised, could happen for people that have bad insurance. It's absolutely true. But special treatment on the high-end side is not good treatment either. And special treatment is entitlement. The client dictates everything. You bend over backwards, including not giving them good treatment because they don't want it, or their family doesn't want it, or their handlers don't want it, or the agent doesn't want it, or the manager doesn't want it, or the PR team doesn't want it because they're about to do press. And you just want them to, hey, just get them good enough that they can do press. We'll deal with their real problem later. None of that stuff's good. Hey, can we just keep them on this benzodiazepine, Ativan or Xanax or Klonopin or Valium or whatever? Just keep them on it for a while, even though they have an addiction problem, because it's keeping them at bay and they just want to finish this project that they're working on. I can go way into that, but now you add that and you have got a recipe for disaster, because person's not getting good treatment. They have this Hollywood stressor. They've got their own family dynamics, which I haven't even gone into yet. Now you add the family dynamics, making a movie about the struggles that you guys are going through. Who knows what kind of effect that's going to have. And, you know, living up to a successful parent, all of that. None of those is a reason to do what he did. I want to be really clear about that. But if we're trying to get into the psyche of an individual, or lack of judgment and reasoning and executive functioning in an individual who did what they did, this is the recipe that I'm talking about. This is the combustible cocktail. And, you know, last thing I want to say on this is a lot of people have asked me about psychosis. And yes, I have absolutely seen psychosis right in front of me. I've seen it in the prison system. I've seen it in the homeless population. I've seen it in my residency training and my attending training at the academic facility I trained at. I've seen it with private clients, and it can be very scary. So if somebody is acutely psychotic, now I don't know, I wasn't there, I don't know what happened at the party that he was at, but you know when somebody is psychotic, they're in front of you. First off, they might be responding to internal stimuli. That means that there's literally like a voice or a belief or a thought that they have that they are responding to inside their own head. Now, sometimes they actually talk to it, and it might be somebody who's silent, and all of a sudden they're like, no, I don't think that. No, I don't. I stop it. Stop it. And there's nobody there, but they are talking to someone. They're responding to their internal stimuli. Most of the time, they do this without outwardly showing somebody that they're doing it. They're responding to internal stimuli in their own head. That's why they're checked out, okay? Very often, there is this dull, almost like checked out, soulless, lack of cue element to them if you're trying to talk to them or looking at them. I don't know how much we all take this for granted, but we all give each other cues when we talk to each other. When you're having a conversation with somebody, we might nod, or we might nod in disagreement, or we might like look, or our eyebrows might change, or we might blink, or we might smile, or we might do something that gives the other person a sense of, yeah, I'm with you. I might not agree with you. I might agree with you. I might think that's funny. I might not think it's funny, but I'm with you. I have cues. We also have something that I studied quite a bit called micro-expressions. And micro-expressions are little tiny cues that are usually unconsciously read that let us know, hey, we're in this conversation with somebody. Well, when somebody is acutely psychotic, there are no cues. There are no expressions or micro-expressions or anything. You're not getting anything. And if that person then says some bizarre stuff or asks you bizarre questions, whether it's to, prod at you, to get you to have a reaction, or it's because they are not in their right mind and they don't know what they're asking, that can be very frightening and it can be very scary to someone. So anyway, so that's what I wanted to do. Wanted to talk about psychosis, wanted to talk about this recipe for disaster between the mental health aspect of psychosis, the potential mood effect with potential mania, the effect of methamphetamine or illicit drugs that could be on board, the effect of the personality disorder and sociopathy that could be on board, the effect of Hollywood culture, the effect of family dynamics, all this big recipe in one. I promise I will do other videos on this. And please, thank you for commenting. Thank you for subscribing. I'm an expert that has done a lot of work. I have done, expert work and expert commentary in television quite a bit before. I haven't done it much online, and I'm starting to really sense that there is a big population of people that want to know. And if I can lend any support through my experience and my wisdom,